This is Radio Health Journal. I'm Nancy Benson. This week, self-driving cars. They'll eventually change how we live, but until they're everywhere, expect problems.
How can we maybe change the algorithm to make the computer behave more like a human?
The dangerous mix of self-driving cars and human drivers when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
New York Harbor, people have started in recent years to see whales that haven't been seen in that area close to the city, in some cases a century or more.
The resurgence of wildlife in urban landscapes. Then,
the only people who don't have regrets are 5-year-olds, people with brain damage, and sociopaths. The rest of us have regrets.
Understanding the gut-wrenching feeling of regret. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Self-driving cars are the future eventually. They'll be everywhere and do all of our driving themselves. Climb into your own car and close your eyes if you want to, or get started on your day's work. You'll get where you're going faster than you can now, and you can send your car home to park if you want, or to a fringe parking lot 10 or 15 minutes away. It'll come back to pick you up when you're ready. Autonomous vehicles will change how we live. But how soon that happens depends on how long it takes the average person to trust computers as drivers.
Acceptance and adoption of automated vehicle heavily depends on the safety validation of these technologies. So they should be safe before we find them on the roads.
That's Dr. Sohail Sorabi, a postdoctoral researcher at the Texas A&M Transportation Institute. He admits most people don't think a computer can drive a car better than they can, even at the basic level of automation where the best cars are today.
Levels 1 and 2 are more to assist the driver. Level 3 is almost autonomous, but there's still a driver behind or inside a vehicle that can take over. And this is where a lot of the research is being done. And 4 or 5, it's kind of almost 5. It's kind of everything is automated, and the occupants don't do anything for that. So we're not there yet.
That's Dr. Dominique Lord, professor of civil and environmental engineering at Texas A&M. He says self-driving cars will change our lives in a lot of ways, and not all of them are good. He and Sorabi have identified 32 major impacts automated cars could have on public health, and 17 of them are negative. Even how safe those cars are is open to debate.
There is a huge hype about the safety of automated vehicle. Everyone actually talks about their safety. They are supposed to eliminate driver error. 94% of crashes are driver error related crashes, and automated vehicle can actually prevent those crashes. So we can speculate 94% of crashes would be eliminated with automated vehicle. However, this is not true. Actually, we did some research on that area, and we showed that that number is quite optimistic, and we need to have a better evaluation of automated vehicle safety. That's the reason we are not sure how automated vehicle would affect traffic safety.
Lord says that's especially true when not all cars are self-driving yet, and that could be decades. A mix of automated cars and human-driven cars could be dangerous because computers don't drive the same way we do.
Automated vehicles are kind of a program to follow the law, or let's say the traffic laws to the strict sense. But we know that humans, usually they don't always do. A good example is that stop sign. Like a lot of human or drivers would kind of slow down and not stop completely and for 3 seconds and then accelerate. So for automated vehicles, it will do that. So I mentioned the issue is that if you're following an automated vehicle, you expect the driver in front of you to slow down and not stop and then accelerate. whereas will stop. And then the driver doesn't expect that and then hit the rear of the vehicle or the automated vehicles. And that has been a major problem actually in California, like when they were deployed. And we've been doing some work on that, like how can we maybe change the algorithm to make the computer behave more like a human?
In fact, stories exist of self-driving cars that come to a four-way stop and never take their turn to go through the intersection. They're waiting for other cars to completely stop, and humans don't do that.
I would not be surprised if it's true that where, like I said, the auto vehicle is waiting for the other vehicle to stop completely. And if it doesn't, I'm sure that the automated vehicle would not go until the vehicle is stopped. So I wouldn't be surprised if that could be true, actually.
So Robbie says one very positive effect of self-driving cars is the way they could enhance access to transportation for those who currently can't drive. For example, children and those who are disabled.
People with disabilities, they have problem with driving cars. For example, people with mental disability, they're not supposed to drive cars, but they can use automated vehicle as a mode of transportation. And, it's hard for them to get access to transit, for example, or we have some cities, some areas within even big cities that transit system is not accommodating users sufficiently. So automated vehicle can actually fill that gap and address, the limitation of the existing system, but providing a new mode of transportation for people with disabilities.
Autonomous cars will also improve traffic flow. Far more cars can fit on the same roads if computers are driving them.
Automated vehicles are supposed to drive smoothly. They can actually predict the reaction of other vehicles, and they can accelerate, decelerate accordingly. So they are supposed to drive smoothly. They are able to follow the leader vehicle with lower distance. We call it platooning. So there can be a chain of vehicles following each other on a highway with no problem because we don't have driver error, right?
What we do when we travel will also change. Now we can listen to the radio or a podcast or talk with a companion or someone on the phone. In a self-driving car, we can do almost anything.
With automated vehicle, you're supposed to sit in your car, do your job or work or, enjoy your time, have a couple of beers, or communicate with other people. So the travel would be cheaper. In that sense, people tend to live farther from their workplace. In that case, we will have even urban area with lower density. We call it urban sprawl. So urban areas will expand.
But does that mean traveling by car is too comfortable, quick, and convenient? More roads will be needed, farther away from central cities, and more cars will generate more pollution. So while self-driving cars sound like a really good thing, in practice, they may be more of a mixed blessing. You can find out more about Sohail Sorabi, Dominique Lord, and all our guests through our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Facebook and Instagram. Our production manager is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Coming up next week on Radio Health Journal.
I think this pattern of using these apps can get you kind of a little obsessional circle.
How diet apps could be hurting your health.
Then grown-up goldfish are taking over ponds and lakes.
There may have been these invasions going on under our nose and we just never even knew or just couldn't believe that that's what it was.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.